Meet Ebrahim, a 35-year-old gentleman. Once full of energy and vitality, he noticed life felt dull. He was tired even after sleep, less focused at work, and his once sharp drive, both in business and in the bedroom, was fading. He brushed it off as just getting older, but deep down, he knew something wasn't right. Testosterone is the primary male sex hormone, though women also produce small amounts. It drives muscle growth, bone strength, red blood cell production, mood regulation, and sexual function. Without enough testosterone, men often feel like their engine is running on half power. In men, most testosterone is made in the testes, but the signal starts in the brain. The hypothalamus releases GnRH, telling the pituitary gland to send LH to the testes. There, specialized cells produce testosterone. It's a feedback loop, like a thermostat, keeping levels stable. Normal testosterone in men ranges from 300 to 1,000 nanograms per deciliter. Levels naturally peak in the early morning, then dip through the day. Below 300, symptoms of low testosterone, like fatigue, low libido, and mood changes, become common. Ebrahim's lab result? 260, below the line. Testosterone naturally falls about 1% per year after age 30. But lifestyle accelerates the decline. Obesity converts testosterone into estrogen. Stress raises cortisol, which suppresses testosterone. Poor sleep, alcohol, and inactivity drag it even lower. Ebrahim's long work hours, processed diet, and lack of exercise made his drop faster. Low testosterone doesn't shout, it whispers. Fatigue, poor concentration, loss of muscle, increase in belly fat, low mood, reduced libido, and even brittle bones. For Ebrahim, it meant less drive at work, less energy with his kids, and a quiet distance in his marriage. After months of struggling, Ebrahim visited his doctor. Blood tests confirmed what he feared: low testosterone. His doctor explained the options: lifestyle changes first, then possibly testosterone replacement therapy. TRT is the medical replacement of testosterone when the body can't make enough. It can restore normal levels, improve energy, mood, libido, and muscle mass. But it's not for everyone. It requires clear diagnosis, careful dosing, and ongoing monitoring. TRT comes in several forms: gels, patches, pellets, and injections. Ebrahim chose injections. Common options include testosterone enanthate, cypionate, or undecanoate. Some last a week, others longer. The method isn't about building muscle, it's about restoring health. Typical safe starting doses range from 100 to 200 milligrams weekly, depending on the formulation. More is not better. The goal is normal levels, not bodybuilder doses. Ebrahim's doctor started him at 125 milligrams weekly. TRT carries risks: acne, oily skin, hair loss, mood swings, infertility, worsening sleep apnea, and increased risk of blood clots. These side effects highlight the importance of proper monitoring. That's why follow-up blood tests are essential to monitor TRT effects and adjust dosages as needed. Ebrahim agreed to regular checkups every 3 months to ensure his health and safety during treatment. Not all men need TRT. Natural ways to boost testosterone include good sleep, resistance training, reducing belly fat, managing stress, and a diet rich in protein, healthy fats, and micronutrients like zinc and vitamin D. Ebrahim added these habits too, for long-term success. But what happens when testosterone is abused? Bodybuilders often inject far beyond medical doses. At first, muscles grow, but so do the dangers: liver damage, heart disease, shrunken testicles, infertility, mood swings, and sudden death. Hormones are medicine, not gym supplements. With TRT, regular monitoring, and healthy habits, Ebrahim regained his spark. His energy returned, his mood lifted, his strength improved, and his relationships grew stronger. Balance, not extremes, changed his life. Testosterone is vital for men's health, but balance is everything. Too little and life feels flat. Too much and the risks outweigh the gains. Ebrahim's story shows the importance of diagnosis, medical guidance, and lifestyle. If you found this episode of Medical Minute valuable, give it a thumbs up, subscribe, and hit the bell, because sometimes the most powerful prescription is knowledge.